Hi everybody, welcome to Chapter 6 for Children's Health and Safety. This is our final chapter and our final discussion point before our first test, which will cover the first 4 chapters in the class. As usual, I present for you the NAEYC standards that are going to be covered as a part of this chapter. So this is really aligned with our first project in the class. You're creating this newsletter that looks at diseases, so this is something that we're going to be talking about over the first few chapters, and we've looked at them, but we're going to have some more that we visit as well. So one of the things that you have to do, children have to understand they have responsibilities as kids to prevent illnesses as well. The best thing that a child can do to prevent illnesses from transmitting to others is not be in school when they're sick and wash their hands. That's the easiest and simplest thing to do. Cover their mouth when they cough, wash their hands, use Kleenexes where appropriate, and that's things that you can do to improve illnesses from being transmitted. So children experience many forms of illness, and not all of these are contagious. These cause kids to be uncomfortable and miss school, but what I need to stress is that if something goes wrong, you as a teacher or an early learning provider, you should never diagnose a kid with a medical condition. You contact the family and ask the family health provider. If the family permits for you to do so, you can contact the family health provider. But you don't have autonomy to do this, and I don't want you to think that you do have autonomy to do this. So colds are common. Kids get these at a young age, 7 to 8 times a year, and they are contagious. When one has one, it's going to pass to the other. It's just going to be an annoyance more than anything else. You can supplement them with medicine to help them, but you really can't cure it. These are things like sneezing, runny noses, fevers, sore throats, coughs, headaches, and muscle aches, and that really comes with colds. So most of the time, 1 to 2 days is the incubation period, and it's a virus. It's easily spread among children because, kids are around kids with colds. Parents are still going to send their kids to school with a cold, and it's going to spread to others, and that can create a problem as well. So, parents are going to send the kids to school. It becomes a problem for the other children in the class because then they're exposed to those decisions. So, if you see there are kids that are really sick, that are experiencing colds, try to refrain from group settings for the day when the cold is present, or don't kind of isolate them, but sit them to the back where they can still interact with other kids, but recognize what exists. So how do you treat the common cold? You give them fluid and you cause them to rest. Antibiotics can help, and they can stop from it getting worse, but in all honesty, the best way to treat the common cold is rest, 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 rest. So those of you in early learning centers might be working with children with diaper rash if you're in an infant room. If an infant has sensitive skin, and infants are formula fed versus breastfed, they're probably going to have diaper rash more frequently. If parents or child care providers don't change diapers enough, this can be a problem because urine and stool remains in the diaper, and it can burn the baby's skin because the baby's skin isn't fully developed. Different fabric softeners, depending on them, can cause diaper rash. So my advice is you try different things and you see what works. This is why the ratio in an early learning center for infants should be no more than 1 to 4 because you're going to be changing diapers frequently. So changing diapers isn't the problem. It's the aftercare associated, and that's where child care providers drop the ball. So try to use petroleum jelly, zinc oxide, to prevent children from feeling pain. And if children have diaper rash, you can have them go without diapers at home. That can help them heal as well. So young children get diarrhea because their digestive system changes. Most kids until the age of 4 get diarrhea at least once a month, then every 2 months until the age of 8, and then as you become an adult, it lessens normally because your digestive system has grown and it has adjusted to your eating patterns and who you are. Diarrhea is viral and bacterial. Different things can cause it, like cold, strep throats. Food poisoning doesn't really occur much among children, but if an adult has diarrhea, it could possibly be caused from food poisoning. So rotaviral diarrhea is the most common cause among children. and it's a vaccine that most kids receive prior to 6 months. If there's limited access to child health care, you're going to see this more in an urban school setting than you are in a suburban, where the kids are going to naturally be vaccinated for this. So, children that are between 4 and 5 that understand what it is, they don't want to talk about it, they're embarrassed. If you're a child care provider, the parent really should let you know this happens. If you can exclude them from group settings, that's good, and I think you should, because you don't want self-esteem issues for a child at a young age. That's definitely something you need to consider. So, some kids get dizzy after they play. That's common. It's nothing to worry about, but you should track it. If it's a common occurrence, then you've got to be worried about it. But if it just resulted from intense play, then you have to consider that as something different. So, people worry about dizziness because it could occur as a result of a tumor. Dizziness should be invested regularly with a pediatrician, just in case. And if there are bouts of it, try to discuss it with the parents as soon as you see them and encounter them. So, if a child says, "I'm dizzy," have them lie down with their head between their knees until the sensation is passed. Give them an extra minute of rest after they feel fine for each year of their age, because you don't want them to come up, start engaging in intense play again, and then get dizzy again. If it causes uncoordination, lack of balance, they fall over, then you really need to check with a physician at once and notify the parents. So, boys get earaches more frequently than girls. It's something that will occur a lot before the age of 4, then it starts to decline through adolescence and adulthood. Many of us don't get earaches anymore because it's more related to how the ear grows and how the ear develops. If the parents, it's 50% less likely for parents that breastfeed as opposed to formula feeding. Notice that our textbook really supports the notion of breastfeeding as being important. Group care settings, children experience more earaches as well. What causes it? If they get a bead stuck in their ear, dental cavities, new teeth coming in, always cause an earache. Colds do, allergies, excessive earwax, and bacterial infections as well. So, most children, when they have earaches, it's difficult for them to express themselves. So they'll cry, they'll fidget with their ear a lot, they'll vomit, they'll be nauseous, and they won't eat. It's one that they don't like to express as much, but it's something that can cause a challenge. So, because it's common during those years, it's difficult for them to communicate. Kids, one of the easiest ways to tell, they won't eat or drink because they don't want to swallow, or if they pull and rub on their ear, you know they probably have an earache. And then you can take them to a doctor, 12 to 24 hours, maybe it can be something that can be cured. So, this is something that's a little different. When a kid has an ear infection, you want them to be in a group setting. You want to distract them as much as you possibly can because you want them to forget about the situation. Distraction is the best treatment for an earache because even when they're on medication, it takes 48 hours for a child to start to feel better. Fainting, people lose consciousness because blood supply to the brain is temporarily reduced. So, children hold their breath and refuse to stop. They do this when they're pouting, they do this when they're angry, or if they have high stress or high excitement, this can cause them to faint as well. Some faint because of pain or poisoning also. So, if a child feels dizzy or weak, the first thing that you should do is have them sit down. If the child feels cool, feels moist, or their skin looks pale, then you know that there could be an issue as well. If a child does collapse, put them on their back, put a pillow underneath their head and watch their breathing. Let them regain consciousness and then supply them with food or drink, something that's going to help their electrolytes rejuvenate. So, fever changes all the time in children. Children can get fever just adjusting to growing and developing. It can be an indication of an illness or infection, or it might not be. It can be caused by viral and urinary tract infections, or it could be from overheating or being in a particularly cold environment or a warm environment as well. So, what are the early indicators? Flushed or reddened face, listlessness or desire to sleep, glassy eyes, loss of appetite, complaints of not feeling well, chills, warm, dry skin, or increased perspiration. So, how do you manage fevers? You check temperatures regularly. Don't use glass mercury thermometers ever. At this point, nobody should have glass mercury thermometers. If you do and you're still using them, we've been past that for about 20 years now. If a child has a temperature above 99.1 degrees, isolate them, send them to another room, and don't administer medication unless there's approval from a physician. So, children under the age of 8 don't really get headaches. Most of the time, if they do get them, they're so minor they don't complain about them. But if a child does complain about them, you need to address it as soon as possible because it's something that is a very serious concern. So, how do they disappear? They disappear with rest. You create a quiet place so that children can rest and recover. Families should be notified, but not be that concerned unless there's discussion with the physicians that says that there's something specifically causing the headache. For infants and toddlers, you could see heat rash. This is caused by a blockage in the sweat glands, and obviously heat rash will occur in warmer environments, so it'll normally happen during the summer months. Some kids have sensitive skin, and parents that are still learning their child try different detergents, and some detergents work well, some don't. Some have rashes according to the fabric that they wear. Measures should be taken to make kids feel more comfortable. Wash with cold water when you can, and dust with cornstarch when possible as well. So, Lyme disease, we only mention this because it's common among the East Coast, and it does occur, and it's something that is rising throughout the United States. Until about the age of 14, this is increasing, and children are susceptible to it. I only mention it because it is something that is East Coast specific, and if you're going to work in an early learning center, you should be aware of it. So, you get a tiny tick bite with a deer tick. Not all are infected, nor will you be infected if you're bitten by one that actually has it. But if it does, there's a possibility that it could cause it to happen. So, kids are going to spend time in grassy or wooded areas depending on the location that you live in. If you live in a rural environment, kids grow up outside. It just is what it is. It's overlooked very frequently because people will see it as, oh, my kid's just not feeling too hot, they have a cold, they have a flu, and that causes them to kind of forget about it, and people aren't prepared for it. All kids get sore throats, especially during the fall and winter seasons. They will verbalize discomfort, so you kind of have to observe it, but it's common, and it happens for all kids. So they're viral and bacterial, can be caused from sinus draining, mouth breathing, or allergies. Could be caused from them talking way too much as well. When you have a sore throat, you need to make sure that it doesn't lead to something more serious. Sore throats and strep throats are highly contagious and can be spread to other children. If you see one, take reports of a sore throat seriously. Make sure the children aren't included in group activities and parents know if it's a problem, and try to keep them with fluid, and try to keep them with cough drops or something that they can use to soothe the sore throat. Kids get stomach aches all the time. Children can't differentiate what it is. It could be a cramp, could be nausea, or it could be emotionally being upset as well. So, stomach aches are what a child will say when they need attention or they have emotional stress. If a kid wants your attention, they're going to say, my tummy hurts. So it's very difficult for you to know whether or not their tummy actually does hurt. That way you need to monitor what they do and check to see how they're behaving. So if it's serious, kids will go to the bathroom frequently. As soon as they go to the bathroom, ask them if the pain is gone. If a stomach ache is not that serious, the kid will want to play and interact with others. And that's your way of knowing whether or not they're just seeking attention. If the stomach ache is serious, the kid probably will not want to play. So, what you need to know. If it disrupts a child's activity, running, playing, eating, and sleeping, that's a problem. If the abdomen is tender, that's a problem as well. If there's vomiting or diarrhea and severe cramping, then you know that the child probably is telling the truth. If it's lasting for a long time, then you know it's probably not cramping and it's probably some sort of illness. If their stool is bloody or has mucus, then that's something that you have to consider as well. So SIDS, this is something that you're going to see on the PECT exam if you're going for the 4-year degree. Infants under 12 months of age can just have a sudden unexplainable death. It's one of the leading causes of infant death in the United States. It happens more often at night, but during the fall and winter months. About 2,000 to 3,000 rates of death happen a year because of SIDS. So, as I said, this was on the PECT. I give you a list of things. You can read these on your own, but this definitely was something that you'll see on the PECT practice exam. So, SIDS correlates with sleep apnea. So, you need to be careful about toxic mattress fumes, immunizations, pacifiers. If the child has the pacifier all the time, that can be a problem. Air pollution or unequal streams of air coming into the room. Parents that co-sleep with their kids, that's a big problem. Swaddling and respiratory infections as well. So I mentioned bed sharing because there is current research on this. You have to decide what's best for you as parents, but I mean, obviously, you don't make these decisions as a child care provider. Right now, current research says best practice is for the parent to allow their infants to sleep next to their parents in the bedroom in a crib. That's what current research says. That is the best practice. The infant shouldn't sleep with them. They shouldn't sleep in a separate room. This gives the child access to their parents when they need it, but once again, I'm not here to tell you how to be a parent. I'm telling you how to work in an early learning center or a school district, but I'm giving you this because it's current research. So, baby sleeping, babies always must be placed on their backs when sleeping. I bold this because this is a big, big, big idea. Make sure that their oxygen intake is good. They should have light sleepwear and be tucked under the bottom half of a mattress as well. So, if you want to look at any resources or information on SIDS, I provide this for you. You can do this on your own. So, teething. Teething is a natural process that can cause pain and discomfort in children. Around 7 months of age, kids will lose their first teeth, and then they get their permanent teeth starting around 5 or 6. This causes discomfort, and there's a direct correlation with teething to earaches. Drooling also occurs as well. So children don't experience toothaches. The way you prevent it is through oral health care, and we'll discuss that later on in the course. So finally, I mentioned gum disease. If that happens through the teeth coming out, the baby teeth coming out, and the gums being infected, it could cause ear problems, earaches, could cause redness and swelling. When this happens, try to avoid foods that are hot and are sweet. Okay, that's it. I want you to look over all these slides in preparation for the test. If there's anything that I can do to help, let me know. But we've covered everything in our first third of the class. Thank you.